imagine being in need of urgent medical care, of making what for many people will be a long and possibly very expensive journey to get to your nearest hospital, and then getting there to find that the person who could potentially help you can't understand you properly. How do you communicate where your pain is? Speak to the other symptoms that you might have if you don't have common language. Yes, you can point, you can gesture, but those only get you so far. And firstly, there is the risk of compromising clear communication. And secondly, there is the impact on dignity of having to communicate that way. So it really is essential that our healthcare professionals in a country with the language diversity that we have in South Africa learn to communicate in more than just their own home language. And as the mother of a current medical student, I can tell you that some basic language learning is built into the curriculum. I know my daughter has had some Afrikaans and IsiXhosa built into her curriculum from day one, and she still does in year 4. But it only goes so far. So I was really intrigued to hear about a young academic who has come up with his own way of addressing this challenge in a form that is easy to use, that is convenient, that is cost effective, and I think crucially for this particular sector, doesn't ask too much time of people who are already facing a massively pressurized diary and workload. His name is Sonwabiso Ngqowa. He is a PhD student in the Faculty of Medicine at the University of Cape Town, and he has recently developed a WhatsApp program to help healthcare professionals master some practical and respectful IsiXhosa. It's great to have you with us. Welcome to the studio.
Thank you so much for having me, Pippa.
It's a pleasure.
Thank you.
Before we talk about the course, you've got a fascinating background because you've come into the medical faculty out of a background in anthropology, I believe.
Yes.
Tell us more about your route to this point.
Yes, so my background is indeed in anthropology.
Yep.
I did anthropology at the University of Cape Town, focusing on children's child health, looking at the Road to Health booklet and how mothers perceive it and understand it as a port of call in one way, as it tracks the children's growth. So I did that through an anthropology lens to sort of understand it from Xhosa women and how do they understand this document in English and yes,
okay. So here you sit now working towards a PhD, and this idea of how we understand, and it's medical terminology and jargon and important concepts, but on a broader scale, not just with that one document, but more broadly speaking, what happens when the medical professionals who are treating you can't speak your language. What made you decide that you were going to do something about that? What made you care so deeply about this issue?
Yes, you've mentioned that I'm doing my PhD in palliative care at the University of Cape Town, supervised by Professor Klaus from Presentine and Professor René Krauser. And from observations and working with healthcare professionals in research assistant work, in transcription work of interviews that were done and in various settings, looking at how language can be a way of seeing someone or dignity or a way that we may unintentionally not see someone, especially IsiXhosa being the second most spoken language in the country and in the province as well, at over 30%. It's one of the important languages, as you mentioned earlier on in that great introduction. Thank you so much for that.
Thanks for that. Yeah.
So palliative care, I'm doing research in social and cultural determinants of health in palliative care, to understand what do people make of palliative care from different religious backgrounds, different cultural backgrounds, different socioeconomic backgrounds. How do they receive palliative care? That doesn't say palliative care. That doesn't say it's the end of everything, but it's a way to help people manage what they are living with, the chronic conditions that they've been diagnosed with and living with. How do they manage those best and the different symptoms?
Okay. So from that into the development of this WhatsApp program, I mean, you've just emphasized that language is not just about communication. There's so much more to it, and if you are not able to communicate in a shared language, some broad comments. How does that impact one's experience of healthcare generally, even looking beyond palliative care? What are some of the challenges that you've found that patients have said to you because of the language barriers between themselves and healthcare professionals?
Research supports this as well, that healthcare professionals find that they struggle to explain things to patients, but also understand what patients are trying to explain to them. I mean, there's research that supports that, and also having worked with the people in the field to try and explain. Already there's a cultural difference. There's probably about 8 out of 10 times that the patient and doctor cultural backgrounds are different, socioeconomic statuses are different, and the different they come from different backgrounds. So put that together and added on top of that, there's the language barrier then to try and explain something so sensitive and deeply personal in a language that one doesn't speak every day. So I think it's very important also for palliative care as well as other medical fields as well to have this access.
I mean, so obviously, on a practical level, I mean, there are very, very direct consequences if somebody has misunderstood what they've been told about the dosage of a medication or how to take it, for example. But it's more than that. You've mentioned the word dignity several times now. I mean, do you want to expand on that? It's about a patient feeling seen and valued and truly cared for. How do you even begin to experience that if all you've got in front of you is a wall between you?
Yes. And that's why we're thinking about how do we make the patient seen and valued and also to be spoken with as opposed to being spoken to, yes. Yeah. So that's why Lewis, which is a language in workplace solutions, helps healthcare professionals who are very busy to not commit to another hour or week of learning outside of their working areas, but to bring something that's practical, that's within the workspace, in sort of WhatsApp, as you mentioned, and short video links, and also printable or charts that can help healthcare professionals for that dignity, for that respect, for the patient to be seen, to be understood in a language of their own, to explain something so deeply personal. Yes.
I'm so glad you mentioned the reaching them when they can be reached, because I'm smiling here. The minute I heard about your program, I mailed all the details off to my daughter, my own medical student daughter, and I literally haven't seen her to say, hey, did you get it? Because the shifts are long. She's been leaving before I got up and getting home after I've been to bed, kind of thing. So that's a crucial thing. You're talking about people who have got incredibly busy schedules, who are not going to be able to commit to every Tuesday evening we do XYZ because they're on call at different times. So how does it actually work? Talk us through the logistics of how they receive your Lewis course.
Yes. Thank you for that, Pippa. So I like that you mentioned that these are very busy professionals, and it's complementary to what UCT is already doing in terms of language. So to be seen as complementary to what the government is, if we think about the Batupele principle of putting people first, so it's complementary to what's already happening. And professionals who are very busy, what Lewis does is we send videos, short videos and audio every morning, weekday morning, for professionals to learn and practice the sayings and contact us as facilitators throughout the day and when they have time. So it's learning in context. It will also support them with charts that they can use in their work settings to make sure that they keep practicing the language, because language is, as you say, what happens beyond the structured learning of a period of time. What happens? It has to be continuously done. So Lewis offers that continuously through WhatsApp.
Just for anybody who's coming in midway to this conversation, my guest in studio is Sonwabiso Ngqawa, who is a PhD student in the Faculty of Medicine at UCT, and he has developed a practical IsiXhosa course called Lewis for healthcare professionals specifically, and it's aimed at anyone from someone at the beginning of their healthcare journey as a student to people who are already in practice. Is that correct?
100%, that's correct. Okay. People who are already in practice, people who are working, who have experiences that we also like to work with at Lewis, to say, what do they see every day? What would they like to say most to patients in their languages, in IsiXhosa specifically? So we work with professionals in the different tracks to tell us what they would like to learn most as well. So we've developed the program, and we have the lessons and the different videos, but we also work with participants to tell us what else would they like? What more do you need? How can we support you better to have that full conversation with the patient in this class?
So talk to us about the beginner modules. Firstly, does somebody have to have any? As I mentioned, medical students are all getting some IsiXhosa exposure as part of their degree, but it's limited, and it's a small part of a much larger curriculum. Can you come to this as a complete novice who's never had a word of Xhosa in their life, never spoken it, never had a lesson? If somebody was to arrive in South Africa tomorrow saying, I'm a newcomer and I only speak English, could they start this course?
100%. We encourage that. We encourage people to come in with no IsiXhosa background, to start with us, and we gradually, teach them or work with them, learn with them as we develop through the different stages of IsiXhosa. So people who have some IsiXhosa background, we do an assessment before the start to see where they can start, we advise them on where they can start. So we really encourage people who have some IsiXhosa background, and those who don't have.
That's great. And for somebody who is starting as a complete newcomer, talk to us a little bit about what sort of things you cover. Is it phrases? Is it basic vocab initially? I mean, I would imagine you have to learn the names of the body parts, for example, but I'm sure it's a lot more than that.
Yes, we do introductions to greetings, respectful greetings, seeing people greeting the different ages. How do you greet people from different ages? We do those, and you spoke about body parts. We do introduction to body parts and naming of the different body parts. We do culturally appropriate diagnosis, and how do you talk about sensitive issues like death. I'll give you an example. If one took a word from AI that says AI is very great and supportive of various things, but learning a language
nuance.
It lacks nuance. So, for instance, I put in something about death on AI, and it brought back a human death. It brought back ukufa, ufile ubani, which is, you don't say ufile a person, if something. A dog or a plant, but there are different words that you use for a human being who has passed on.
Okay.
Ububile, uswelekile, usishile, for instance. Yeah. So it lacks nuance, as you said.
And you would potentially completely unwittingly and unintentionally cause offence by using the wrong word.
Unintentionally.
In that context. Yes. Okay. So this is hugely important. As you said, language is a living, developing thing.
Yes.
In practice, it's not something you can just learn from a book. And the fact that this is video and audio, obviously pronunciation is a huge part of this experience as well.
Yes.
You've mentioned you start people where they are and build them from that. And I'm looking at an example of what it is you offer further down the track. So somebody literally who has specialized to become a surgeon, there's an option to follow a sort of a surgical track that goes into that language, and those descriptions of the items you would find in a surgical theatre, for example. There's a totally different track for those who are going into pediatric medicine or somebody who's working in behavioral health. That's a lot of content because there are a lot of different branches of medicine. Are you developing all of this on your own, or who's creating the content?
Well, I've started it on my own, but we're beginning to get support, and also as Lewis grows, we'll need more support to work with people. Hanske Freilinger, who has experience in occupational therapy, has been very supportive of the program, and we've started working together. So we're beginning to have a team that will look at things and sort of help as we develop various things. Yes. Yeah.
So before we run out of time, so how does one access this? Do you need to start on a particular date and roll with the course, or can you sign up at any time? How does it actually work?
Yes, we're actually rolling out and starting on the 1st of September. We do intakes at the beginning of every month. So people who start on the 1st of September will do September, October, November, and then we'll do the tracks next year. So it's continuous in that sense. And they can contact me via WhatsApp and on 079 833 2310. 079 833 2310.
Okay, so I've made a note of that number. If somebody listening didn't have the opportunity to write it down, maybe you're behind the wheel and can't write it down, you're welcome to mail me after the show and I will pass on that number. But again, one more time, it's 079 833 2310. How are you costing it? This is a lot of work and nobody expects you to do this for free. What's the charging structure? How does it work?
So the charging structure is 18 rands per weekday. It's 18 rands that people would then pay monthly. It's 18 rands per weekday, yes. Okay,
so it's an affordable rate. It's in an accessible format coming via WhatsApp and to be engaged with when you have the window in your day that you can engage with it. I think it's a fantastic idea and it's so desperately needed. So I hope that we're going to get some more people signing up listening to this interview. And again, they can reach out to Somabiso on WhatsApp, but please keep in touch with us and let us know how it's going.
I will do.
And thank you so much for making the effort to come into studio today.
Thank you so much, Pippa, for having me.
It's a pleasure.
Awesome. Thank you so much.
Again, his name is Sonwabiso Ngowa. He is a PhD student at the Faculty of Medicine at UCT. And if you are listening to this, interested in signing up for the course, please just pop him a WhatsApp and let him know. The next intake starting on the 1st of September. And it'll take you through everything through basic clinical and respectful greetings and introductions, so basic vocab and pronunciation for everyday phrases you would use in a healthcare setting, and then beyond in the direction you need it to grow with you.